Hey, Brandon Dilbeck here with SpectrumFormed.com. We're back with David from A Beautiful Success, or Aesthetic Solutions, sorry. Today we're talking about hormone pellets and how some of the industry is changing on the delivery and what they're offering nowadays. So Pellecom has come out with some, what seems to be rather revolutionary device, I would say. It's the delivery device. So tell us about the delivery device first, what's unique about it, and then let's hear about pellets.
Okay, all right. So what's unique is for years and years, actually for almost 81 years now, you've had the standard trocar, which is okay, it'll get the job done, but it's very rough on a patient's skin tissue, and it's much harder to get the technique, so the learning curve is a lot higher with this.
Okay.
All right, with the Pellecom system, number one, the overall patient result is much better from the insertion point to actually, having the pellets themselves, because it's a much more easy, consistent way. Every insertion is the same every single time, and the problem with the traditional trocar is that it's almost never the same, and that affects the consistency, from that patient, and they just don't get the results every time.
I know we've seen the trocars in the industry for quite a while. Some doctors use them, some doctors don't. I know I've heard a lot of patients say how uncomfortable it was after. So with the delivery system, and we do have a video of how this is delivered, and you can more visualize what we're talking about. I would watch that video, and it will show how these pellets are inserted under the skin and how much more comfortable it is on the patient, and a better delivery because what word did you use? How it dissolves?
It creates more even dissolution.
Dissolution.
Right.
So it's going to more evenly dissolute into the patient.
When you push pellets into the skin tissue with a trocar, and if you have some scar tissue that's built up, right, that can push a pellet down.
Yep.
All right. Or if just because they back up, they can overlap. All right. They can do this, and every one of those pellets is going to dissolve at a different rate. So it's not that consistency that the patient gets every time. With the Pellecom system, every single time, it's perfect.
So we have actually a demonstration of what we call a train wreck, and it's showing the trocar delivery system and how pellets can go different ways versus the Pellecom system, and I'll show that to you. So you can see how it's hard to take a standard trocar and make the same delivery each and every time.
Yeah.
Okay, so Pellecom goes a little bit further than that. We're talking about pellets, not about injectables. Now,
Right.
and from what I've seen, a lot of people are still doing injectables,
Sure.
injectable hormones. What are the disadvantages, advantages, differences in pellets versus the injectables?
Okay, all right. So I can speak to this because I've been a patient of both.
Okay.
And with the injection, you're dealing with a synthetic versus the pellets, which are a true bioidentical, not biosimilar,
Okay.
like the synthetic, bioidentical. The pellets give your body exactly what they used to have and make at a proper level. With men, of course, primarily testosterone. With women, it's progesterone and testosterone. So
It's a bioidentical hormone.
it's a bioidentical.
It's a better product.
It's a much better product. Plus, right, like I was telling you, when I was doing the injections, I would work with my urologist. Some visits she would say, you're too high, you got to go get blood, right? Other times you've got to boost it, and we could never really get a consistent flow for me to be in the right place.
Okay.
With the pellets, right, I was there immediately, and it's much easier because, right, they're in a good place. I only have to do it. Men typically are, 3 times a year.
Okay.
Women are 4 times a year.
Okay.
And that's
so
it.
not the weekly injections of testosterone.
Yeah, it's so simple, and a better overall result.
So better overall result, one, because of the product itself, bioidentical hormone versus a synthetic.
Yeah.
2, the 3-month delivery in a fluid manner, so it's not train wrecked, jumbled up,
Absolutely.
and the dissolution is smooth through all the pellets, so it lasts and dissipates correctly.
That's right.
They also have these for men, which I know a lot of clinics do, but they also have it for women,
Yes.
which I know a lot of clinics don't do. Now, as far as Pellecom goes even a step further, I've gathered, and they train you. So if you
Yes.
don't know hormones at all,
Yes.
you can learn it. Or if you
Absolutely.
know how to do some hormones, they can
Train
teach
you as
more.
well.
Okay.
Yeah, so the training, it can be a critical piece because, they will, of course, go through the industry. They'll go through panels with pellets and give them what to look for, right? Then they're going to go and we're going to do the hands-on with
delivery.
the actual with the system itself,
Okay.
right? And we break it up into 2 days so that people really have a fantastic understanding.
So they learn how to read the blood work,
Yes.
and then how to choose the proper dosage,
Yes.
and then how to deliver
And how
that
to deliver.
dosage.
Exactly, right. And at the same training, like we were talking about, Pellet is in September coming out with an advanced delivery system for weight loss.
And we're going to
Weight
talk
loss
about that's fantastic. I'm super
Yes.
excited to hear about that one. We're
Yeah.
going to talk about that one here in a minute.
Okay.
So if you have any questions about Pellet and their pellet delivery system and their pellets, give us a call, 800-864-3894. Thank you, David.